Welcome to Recovery Roll Call, where hope has a home. Here, the experts of GRC's Advanced Recovery Network, a not-for-profit with over 50 years of experience, offer a full continuum of care. With 16 locations across southwestern Pennsylvania and statewide telehealth services, GRC's Advanced Recovery Network provides individualized, evidence-based treatment and family programming. Our goal is to help increase knowledge on the disease of addiction, share the many roads to recovery, and reduce stigma in our communities. All right, let's take roll.
When someone takes their first step toward recovery, the process begins long before therapy or groups. It starts with stabilizing the body. Welcome, everyone. I'm Melanie Winter, co-host and producer here in the studio with Dr. Julia Diallo of GRC's Advanced Recovery Network. Dr. Diallo, how's your day going so far?
Pretty good. Thanks for asking. How about you?
It's good, thank you. It's great to be here with you today.
You too, thanks.
Thank you. To get us started, Dr. Diallo, can you walk us through what happens during withdrawal management?
Of course. Yeah, so withdrawal management is oftentimes also known as detox. People kind of refer to it as that, just so people understand. A lot happens during withdrawal management, to be honest. So we admit people to our withdrawal management units 24/7. So we do 24/7 admissions. And so depending on the time that you come, essentially you work through a process, an intake process that is very specific to assessing needs. So we make all attempts to assess mental health needs, physical health needs, in addition to substance use disorder needs. We have nursing on site 24/7. We have medical staff on site during business hours and then available all other hours on call. And so when a person arrives, usually they are first met by a nurse who will just do a quick look at them, and then the whole process starts where we start to take a more in-depth look and start asking a lot of more in-depth questions.
And so how do you determine which level of medical support a patient needs during this phase?
Yeah, that's a great question. So a lot of times that has to do with the substances that they are using, the specific substances, the amount that they are using, and their symptoms. So, and also their history. So for instance, if a person is drinking alcohol in excess and they have a history of what we refer to as complicated alcohol withdrawal, where they've had seizures or they've required hospitalization or they've been really unstable or required critical care. And that's rare, to be honest. We will try to filter those individuals out and then refer them to hospital-based care. But essentially what we do is we assess the specific needs based on the substances, the type of substances being used, the number of substances. So typically people use more than one substance. I mean, that's very common as well. And then we build a care plan around that, which includes medications specific to their needs. And then we are constantly assessing them because the withdrawal process occurs over days. Over hours and days, I would say. And so they need to be assessed frequently to see if those needs change, because sometimes someone will be admitted and they're doing great, and then they can, have a symptom that arises that needs a different medication or an increase in a medication, sometimes a decrease in a medication, and so on and so forth.
And so what symptoms are most common, and how do you help patients stay safe and comfortable?
Yeah. So I would say that it's a little bit dependent on the substance, but generally speaking, people who exhibit withdrawal symptoms will have anxiety, GI upset. So a lot of times they'll have nausea, vomiting, and or diarrhea. They will oftentimes have restless legs, feel restless and unsettled. They can be tremulous or have hands or their limbs are shaking. They can become very sweaty and even agitated, and insomnia is another big symptom. So very poor sleep is common. There's really a whole multitude of symptoms, but I would say those are the most common.
How does withdrawal management differ then, depending on the substance involved?
Okay, so the medications that we use can vary. I would say that's one of the biggest differences. So we use a class of medications for alcohol withdrawal and benzodiazepine withdrawal, and we tend to use different classes of medications for opioid withdrawal or for those using heroin or fentanyl. Um, and then we have a whole list of comfort medications that sort of cross over into all substance use disorders. And then we also start managing mental health symptoms and physical health needs as well on the withdrawal management unit.
And so, what role does emotional support play during this early stage of care?
Yeah, a big one because people are, a lot of times, when you're using substances in excess, you are kind of numb to your life and to the dysfunction in your life and maybe the neglect of the people that you love or, the loss of a loved one or loss of a job or so on and so forth. And when you remove the person or you remove the substance from the person, a lot of times they will start to think, frankly, about all of those things, and it becomes difficult for them, and they become emotional, and then a lot of times they'll have different feelings, like they want to leave, because they feel like they can't do it, or it's too scary, or it's too hard, and so the emotional support that occurs in withdrawal management is vital, and I would say it starts the very first moment they arrive and the nurse greets them, and it continues with nursing care. Our nurses check our patients hourly. Our medical staff see patients daily, and then even more than that if needed. And then we also have therapists that are on the unit. We have certified recovery specialists who are people who have lived experience, who are in recovery themselves. And they are really incredibly vital because they know exactly how that person feels and because they've been there. And a lot of times they can find the words and and sort of the support and provide the support that that person needs in that moment.
And how do you help patients transition from withdrawal management into the next phase of treatment?
Yeah, that's a great question. So there's a little bit of a bit of an art to it. Um, First of all, I think one of our main focuses is this person safe now, and are they comfortable? Because if they're not safe yet, like they need additional, really higher acuity assessment and reassessment and addressing their needs on an hourly basis, then they're not ready for that. And they're not going to have success probably. And so we want to set them up for success. So we want to make sure that their symptoms are managed well, or maybe just resolved in a lot of cases. Um, and we want to make sure that they're safe. And sometimes that transition can be a little bit anxiety provoking because they're moving from more of a medical setting into more of a therapeutic setting where they're going to start discussing all of those things that we just talked about, which are really hard to talk about. But we try to provide a whole lot of support and love during that process. Oftentimes we will say, that we love people back into recovery because there's a lot of that, a lot of that goes into it. So yeah, that's kind of what we focus on during that transition time.
Well, Dr. Diallo, thank you for breaking that down so clearly for us. We appreciate your insight and we look forward to seeing you next time.
Thank you so much for having me.
Thanks for joining Recovery Roll Call. Remember, recovery isn't a destination, it's a journey. One day longer, one day stronger. If you're a family member or loved one of someone struggling with addiction, help is close by. Visit gatewayrehab.org. Call 800-472-1177 or start a live chat with our team right on the website. GRC's Advanced Recovery Network. Hope has a home here. We'll see you next time.